group. They won't see us right away, but it will happen.
Okay.
Okay, ladies, hi, we're back and live with Karen. I'm so excited. I've been really looking forward to this, and I know she has too. She's been inspired. I think we're going to get her training jiu-jitsu any minute. Maybe not. That might be too much.
I don't know. I think I'd love it probably.
I think you'd be amazing. I can just feel it in your spirit.
I like to do that kind of stuff.
So awesome. But okay, so she is a leading expert in my field for pelvic health and all over the groups that I'm in. And she provides the most trusted, reliable information for premenopause, menopause, and hormone changes that go right along with that. And ladies, this is your chance to hear from an expert, right? I mean, like how often do we get an expert in to ask all the questions we want for free? Somebody just is so passionate about what they're doing and wants to just teach and educate and make sure we're getting the right information. So I'm so thankful, so thankful. So she's passionate like me. One of the reasons I started this group was to provide information like this for people who just don't know where to go. And, you know, when it comes to pelvic health and women's health, and they want to continue operating at this athletic level, I think it's important for them to know what's going on with their bodies when it starts to change, kind of what's going to happen. So often in the posts, I was trying to post about how important this information is even before you get the symptoms. And that's something I learned from you too. And, you know, get ahead of this. A lot of this you can get ahead of and be so informed, have better questions for your healthcare providers. And I just wanted to provide this group for that. And Karen is definitely the expert in this field. So I am going to just ask you guys if you're here live to let us know, or if you catch us on the replay, that would be amazing to know you saw this. And of course, if you have questions along the way, please ask. She's here to answer the questions and she's ready for it. So I'm going to hand it over to you, Karen, and tell us a little bit about yourself and what you're up to.
Okay. Hey, I am so excited to be here. I didn't know jiu-jitsu for women was a thing, but my kids did it when they were younger. And I think, oh, that's really cool. I think I'd like to do it myself. Anything that involves strength and things like that. That's cool. So my background is similar to Michelle's. I'm a women's health PT, and women's health physical therapists all tend to have a groupthink kind of personality where we want to share information that we know women aren't getting accurate information for. And so I've been a therapist for about 20 years in a lot of different areas. I've been a women's health therapist for 10 years. And I teach courses in obstetrics physical therapy for the American Physical Therapy Association. But then I started thinking about what happens after the kids get about 10, 15 years old. What happens to mom? And nobody's talking about that, right? I've been through it myself. I totally get it. And so I found out that most physicians and most other medical professionals don't get any training specific to menopause in their medical education. Now, I'm not saying your doctors are bad doctors. There's a lot of good doctors out there. But if they're not getting trained, who's going to do it? And how are we going to get that information out there? So another passionate women's health therapist, friend of mine, Karen Snowden, and I started an education company, and we developed a 2-day webinar to train providers. And I'm not talking about just women's health physical therapists, which we love, and that's what we are, but all providers, anyone who provides physical or mental services, health services to women. So that includes the personal trainers and the nurses and the physicians and the dietitians and the naturopaths and everybody who treats women in their practice. And I'm here today to give you stuff even beyond that, because some of you just want to know this for yourself. And you know what? Information is great. Education is power, right? And I have all these questions about hot flashes. So today's talk's on hot flashes. And I think Karen's coming back a little later to talk about something else. This is a 2-day webinar. So now our education company, and remind me at the end, because you inspired me to develop a patient handout of hot flash, fast facts. So a lot of
that's awesome.
You guys sign up for our mailing list and you get it free.
Awesome. I love it. Thank you for that.
You're welcome. So I'm also a clinician too. I have two businesses. I'm in Snowden and Litos LLC. That's snowdenandlitos.com. That's our education company. But I also have a private practice, No Mom Left Behind Physical Therapy. And I treat women in a cash-based business from the time they enter adulthood through the menopause transition. The North American Menopause Society is very near and dear to my heart. Karen and I are both members. We've gone to their conventions. We've taken our course and compared it against what they're teaching, so we know we have the latest evidence. That is the leading organization in the United States and really in the world in terms of menopause education and research. It has a patient portal that Michelle will give you later. So you can go in and get information directly, or if you're a clinician, you can get information. But that is really a great resource for women. And they have the latest, and I like to teach the evidence because the stuff on the internet, just like anything else.
Yeah. Right.
So you want to talk about flashes?
Yeah, let's do it. Let's do it. Let's just answer the questions. I gave her all the questions.
Oh my God.
Yes.
Yay. So let's start with what a hot flash is, right?
Yes. Perfect.
So a hot flash is an intense feeling of heat that makes you flush and it makes you start sweating profusely. And it's usually it involves your chest, your neck, and your face or head. So it'll come on really quickly. It'll last a minute to 5 minutes. It's also called a hot flush. And if it comes on during the night, it's called a night sweat. All the same thing. And it occurs in women at different ratios. Some feel it maybe a few times a day, and some women feel it several times an hour. So who gets these? Usually, most typically, this is an early sign of menopause. It's a pre-menopause or perimenopause type of situation where you're starting to get hormone fluctuations. And so the average age where women start feeling hot flashes is around 45. Know that it can occur in younger women too. Any woman who is undergoing menopause at an earlier age would be prone to getting this symptom. And I had one question about, can teens get hot flashes? Well, if you think about teens, a lot of them are just starting their menstrual cycles and they're getting hormone fluctuations as well. So yeah, it's possible. It's not as common, but it is possible. And hopefully that would level out over time. Otherwise, that's something that to the person who asked that question, I'd be taking my daughter in and maybe just making sure with the obstetrician that seems like that's within normal limits for her. Okay.
Great.
So why do they occur? Who gets them? We already talked about that. Why do they occur? So hot flashes occur because your hormones start changing at age 30. You don't feel it right away, but they're inside and they're starting to change. And what's happening is those ovaries are getting a little older. They're getting a little less sensitive. They don't work quite as well. And by the time you hit your mid-40s, it's requiring more hormone to stimulate those ovaries. So now what's happening is the ovaries, which are a primary source of estrogen before you go through menopause, are starting to release big blasts of estrogen and then maybe no estrogen at all. So you start to see fluctuations in your period. It may be longer between periods, it may be shorter, it can be heavier, it can be lighter. That's all hormonal fluctuations of estrogen and progesterone that are being released. And that, besides reproduction, estrogen has a lot of other jobs that it does. One of the jobs that it helps do, it's a primary driver for, is maintaining our thermoregulatory zone. And that, if you think about it, is this internal preset mechanism that's a little different in each one of us. But that is what allows us to tolerate temperature changes without changing our core body temperature right away. So if you walk out in the middle of winter in a t-shirt and shorts, you'll get cold, but you're really not going to change your core body temperature immediately. Now, if you stayed out in a blizzard for an hour or two, you probably would, but you're not going to get that immediate change. It's a pretty wide zone. What happens when you start getting these fluctuations is the thermoregulatory zone narrows. So now you're more sensitive to minute temperature changes that you never were before. And that sets off increased heart rate. Some women even get palpitations, and you get flushing coming out of nowhere. And then you're going to start sweating, because that's how we dissipate heat. And so we can get that. And then after you finish sweating, you go into cold sweats because you cooled down so fast. And that goes up and down and up and down and up and down. Someone asked, how long do they last? Wow. Excellent question. Not every woman gets hot flashes, but most women do. About 85% of the population will get hot flashes. And they will vary. It's very individual. Like I said, some of it is just an annoyance that occurs maybe during the day or during the night. They might wake up, or they may not wake up at all, but they may wake up in the morning with a sweat. But they can manage it. About 10 to 15% of it, this is just debilitating. It affects their ability to sleep at night. They can't function during the day. And that's really a serious issue. And these can last from about your mid-40s on average until you go through the menopause process. And they usually stop, not always, but they usually stop about 2 years after menopause. Menopause is defined as it's defined retroactively, actually. So when you stop having periods and you go 12 full months without a period, then you have gone through menopause. If you go 10 months and then you start getting menstruation again, you're not through menopause. You're still in perimenopause. So that's not menopause. So it's 12 full months, then you can be safely sure. There's lab values too, but that's how we define menopause. And then like 2 years, within 2 years after that point, generally the hot flashes will stop.
Okay.
Some of the other
Karen, wasn't there a story that Karen told about this? Karen Snowden told about her patient, a patient of hers who went 12 months without her period. And then I think 2 or 3 months later, she had it. So then clock starts again. Is that true?
After she went 12 months without a period. I don't remember that. I thought it was 10 months.
Okay.
I've had several with 10 months. It's kind of unusual to go a whole year.
What do you think?
I suppose it could happen.
Okay.
That would, oh my God, you'd be so screwed, especially if you stop birth control, right?
Awful. Oh my God.
That would be awful. I know. And menopause in this country usually occurs around 52. No, that's a wide range too, and that's affected by a lot of different things, including genetics. I went through it at 58. So I started getting perimenopause symptoms at 45. I didn't go through menopause until 58. So it can last a lot longer too.
Okay. Right.
But on average, when you hit about 52, generally you're pretty close to being done with it in this country.
All right, good.
So I guess the next thing that people want to know about that I got a lot of questions on, unless you're getting some others you want to ask me and about is, what do we do about it, right?
Yeah, that's a big one. That's a big one.
Yeah, that's a big one. So you want to know about, okay, I'm going to tell you, North American Menopause Society looks at the evidence, right? What's been shown in evidence. And then they even tell you, okay, there's no good evidence showing one. It's a lot of things there's really not a lot of large studies on, but there's some things that you might be able to do that have a more favorable safety profile. And then there's some things that, maybe you just want to stay away from. So the things that work the best, that's been shown the strongest in the evidence for women who are like either younger women or women who are going through menopause in their 40s, 50s, and they're still getting menstrual cycles. Actually, systemic birth control or systemic hormone replacement therapy. That's one of the strongest reasons to take it. It works really well. And that is estrogen with progesterone if you have a uterus, or estrogen if you don't have a uterus. And I know the Women's Health Initiative came out years ago to talk about how this increased breast cancer. Since then, they've done a lot of research, thousands of studies, and really that wasn't an accurate depiction of the research. And they know now that the safety profile is really pretty good. In fact, it's excellent for younger women, and the risk versus benefit ratio is very favorable for younger women who have this problem, who are candidates for hormone replacement therapy. Not everyone is. Mm-hmm. There are certain women who can't take estrogen or just don't want to take it. But I'm going from most research to down on down, okay? So the other option is there are some other types of medications that are used off-label for hot flashes that have shown in the research to be effective. So there are certain antidepressants, there are certain anti-anxiety drugs, and there are certain like anticonvulsants like gabapentin. And these are used off-label systemically, and they actually, in the right low doses, don't have a lot of side effects, and they can be effective for managing hot flashes. So those are prescription options that you could discuss with a physician if you were interested. In terms of the bioidenticals, I had some, and bioidenticals can also be prescription, know that. A bioidentical is just something that's identical to the hormone that you're producing in your body. So progesterone is produced, you can get that in prescription or you can get that over the counter. So that there are a lot of options that are bioidentical. It's not necessarily that one is safer than the other. That's a misnomer. Some of the things that you probably hear on the internet while we're talking about hormones are, say, the hormone balancing thing. And you might get people who are advertising you to take your hormones and saying, okay, you're producing too much estrogen, maybe you need progesterone to balance it out, or testosterone was another one that came up. This is interesting studies because there's really no strong evidence that taking a topical or something like that is going to have the same effect as taking a systemic medication, which is generally prescribed. It's a lot lower dosage, that's true, and it may help some women, but the research has shown it doesn't help most women. And be careful. So progesterone, for example, is often sold, you can get it on Amazon, but you don't know who's producing it. So there are certain companies, and they're not FDA regulated. In most cases, it doesn't contain enough active ingredient to be effective. Well, the idea behind it is you say a topical, you would rub it in and it doesn't pass through the liver because it's not systemic, and it's a lower physiologic dose, and it absorbs in your interstitial fluid and your blood capillaries and things like that. Okay, it's not quite that simple. Without getting way into it, here's what's going on with progesterone. Hormones, progesterone, for one thing, isn't produced by the ovaries to begin with. It's produced in the adrenal glands. Mm-hmm. And progesterone actually is produced at higher dosages after your estrogen declines because it's produced in cholesterol. And cholesterol is ramped up in the liver, which actually ramps up the adrenal glands, so more progesterone is produced. But progesterone doesn't just produce estrogen or testosterone. It does. It's a precursor to another hormone that actually is kind of a bisexual sex hormone. It's called androstenedione, and androstenedione is what's in our blood after menopause more than anything else, and it's an androgen. So it produces testosterone. It also produces estrogen, and testosterone can turn into estrogen. Estrogen can't turn into testosterone. So it's so complicated. They can interrelate. They're all part of these same families. Progesterone also produces cortisol. So that can be problematic if that gets into higher levels too. And also it produces androstenedione or aldosterone, which is actually controls blood pressure. So it's not just that simple. If you're going to slap on progesterone and it's just going to balance out the estrogen, it doesn't quite work that way. However, I'm not saying it never works for any women. I did have one friend who's a PT, and she had PCOS, very, very high levels of estrogen. So when she started getting these spikes, her spikes were like way up. And for her, a topical progesterone really worked. But for the average bear, it probably isn't going to do what you think it's going to do. And be careful, because it does build up over time. They've shown in more recent research that you can get testosterone or androgen type side effects and not even notice it for a while. And I have personal experience with that, because I thought, oh, I'm going to take that to see if it increases my bone density, because testosterone will do that. Mm-hmm. And I didn't quite know as much about hormones and how they worked at that time. And I noticed about 6 months later, my hair part was getting wider. And that's a sign of hair loss, which is a sign of too much testosterone. Okay. And I went to the dermatologist, and she's the one who picked it up and said, yeah, that's what's going on. Stop it. And it took about 3 months and it was reversed. Oh, so just be careful with that. In terms of testosterone, so testosterone, they've done a lot of cool research out, and the North American Menopause Society now recommends it for low libido in certain women, for treatment of low libido. It has other positive benefits that most of you guys who have, I mean, I've seen Michelle's guns in pictures, man. You guys are built. You have a lot, you're working out a lot. That raises your testosterone levels in the blood system. You don't need, most of you probably don't need more testosterone. And if you get too much, there's a narrow regulatory zone for that as well. And then you'll start noticing androgen type effects. So if you start getting hair loss or whatever, that might be a testosterone problem. And so that usually, if you're going to take testosterone, it works most effectively if it's orally and under the guidance of a physician, and it's used for low libido. It doesn't do a thing for hot flashes.
Can I ask you quick about testosterone creams? Because I know there's been questions just in the past about for the libido, like a local cream.
Yeah, they're not recommended. They don't absorb. So the way that hormones work is how they work depends on the route of delivery too. Mm-hmm. So there's different receptors in different areas of your body. So for example, if you're taking vaginal estradiol for vaginal atrophy, that works really well locally, and there's very little systemic reaction to it. But it doesn't work for hot flashes because there's no systemic reaction to it. Mm-hmm. And what they found is that topical testosterone levels, they can't regulate the amounts as well or as efficiently as with oral levels. And that's where the research has been the strongest for working well at physiologic levels. And so you don't have to get a super physiologic dosage, but what they're finding is it's real easy to go supra physiologic. So you're getting too much in your system with topical and other types of preparations. So that's what the research says.
Yeah, thank you.
So I'm saying if you guys are going to do this, you might want guidance and just be very, very careful, because you can mess yourself up pretty quickly. It's not even just that. There's thyroid and other things involved as well. However, there are some supplements. There was things about supplements. So there are some supplements that may be helpful in terms of upping the vitamin B levels. If you're not taking enough of that, there's other things involved with, let me see, I had them all written down here for you. Okay, so phytoestrogens. If you don't have, if you're not having a problem with any kind of estrogens, there are estrogenic properties in certain foods, like soy. And most of you guys are familiar with soy, but there's over 200 foods that have estrogenic effects. Evidence is kind of weak on them, and they're not regulated like over-the-counter or over-the-counter non-prescription hormone therapies are not regulated either by the FDA. However, in Germany, they have something similar to the FDA, and they actually regulate botanicals. So they're looking at things like soy and things like that. And there's some that have been approved for certain things like hot flashes. And then what we do know is there's some that they may help some women, and we know it has a pretty safe profile. So, you know, just because you're taking it and it's natural doesn't mean it's safe. I mean, you know, radon is natural, but you don't want to really breathe it in, really, you know, so it doesn't make it. But also, some of these botanicals can interact with other drugs, and they can cause a lot of problems. All of them, if you're pregnant, you should be checking with a doctor before you take any of this stuff. But there are some botanicals that have some effectiveness. One of the most studied, and they have a fairly safe profile. So the most studied is probably black cohosh, right? Just make sure with these botanicals, anything you get, don't get them on Amazon. And the reason is you don't know where they're coming from. If they're coming from China or other places, you don't know what you're really getting. And they've done studies on botanicals and even the over-the-counter hormonal medications, and they found that 3/4 of them don't contain either any or what they say they have in them. Mm-hmm. And so be very, very careful. If you're going to go to try a phytoestrogen, such as soy or something like that, you want a non-GMO organic soy. You don't want raw soy, and because that can have a thyroid issue. And then also, you know, any of these botanicals, go to your health food store. Go to somebody where you know they're sourced right, because even something like black cohosh, which really people have taken it and it seems like it's fairly safe, and it does help some women. A lot of times they'll put in blue cohosh instead of black cohosh, and that can cause liver damage. Okay. So it's things like that. If you're going to someplace like Whole Foods or Foods for Living, those guys are going to they know what they're doing.
I'm happy you mentioned soy, because I know that there were some questions going back and forth on groups I've seen in the past about soy, stay away from soy. And, you know, I'm glad you're making that distinction of, you know, there's some good benefits to it if you're choosing the right kinds.
Right. You want the right kinds. And soy actually is recommended as a conservative measure by the North American Menopause Society. It's got a fairly safe profile. Now, it may give certain women some, you know, they just don't tolerate it, or it's not helpful, but it's a fairly safe, if you're going with an organic, non-GMO soy. Other botanicals that they've had some small safe studies on include ginkgo biloba, red clover, motherwort. Okay. And of course soy. So
now, Teresa was asking about CBD. Is there any information yet about that, or not? Are we not?
Okay, so not specific to hot flashes, but let me tell you how CBD works. CBD, one of the things we should go back let's talk about other risk factors for hot flashes and what goes into it, you know? So anything that stresses you out is going to raise your heart rate, right? And that can be a cause of hot flashes because you don't have that normal thermoregulatory zone. Anything that increases your heart rate and starts making you stressed might set you off. That could be a trigger for you. What CBD works on differentially is brain chemistry. So it's been shown in a lot of good research that it's very effective for anxiety. And anxiety can be a cause for a risk factor for hot flashes. So with or without THC, CBD may work for some women just from what we know about triggers. Has there been research on women with hot flashes? No, unfortunately. But that's one of those, maybe, it just from what we know about CBD and what we know about triggers. There's other things too. There are, if you're a smoker, smokers get more severe symptoms. So if you can stop smoking, that can help you. Women who have autoimmune disease, thyroid disease, if they have had cancers, If they have high obesity, that tends to affect estrogenic, that has estrogenic effects, and that may make hot flashes more severe for this population. So weight management is important too. Now you guys are doing jujitsu, you're probably all fine. I mean, and I'm saying you have to be a size 2. You can be skinny fat where you don't have good metabolic health. I just want you not gaining lots of weight.
Mm-hmm.
You're solid. That's good. Muscle is great. Don't go by BMI. But if you start noticing a lot of abdominal weight gain, that might be indicative of hormonal changes and metabolic insensitivity to insulin and things like that, that would actually cause more severe hot flashes, but other problems as well.
And isn't that a whole nother topic? Isn't that a whole nother 2-3 days on weight management?
Whole lecture, baby.
I mean, oh my gosh, it's like
I did that at CSM. Karen and I talked for 2 hours on weight management and we talk about it in our course. But those are factors that you want to think about. Even things like warm environments, which we pretty much think of, right? You can get in a warm environment and that'll set you off. So even a hot drink, hot coffee can set you off. So anything you avoid in terms of that, like keeping cool ice water right by you all the time, things like that, that actually might help you in terms of it. And what else? Let's see. Infections, of course, so if you are getting some sort of infection, you might be of any kind, that can actually set you off for hot flashes. In terms of, some of the other things are avoid any foods with additives. So any kind of chemicals in your food, any kind of supplements that have foods with additives or supplements are probably not healthy for you. I think I mentioned the B vitamins and then also vitamin E. That's very helpful for you. Eating a healthy diet does help, especially lots of cruciferous veggies. So that's just your Mediterranean style or whatever works for you. And that also helps with the weight management. So I think that's part of the reason for that, but also avoiding lots of high sugar intake. Because remember, we're getting a little bit more metabolic changes and we have less sensitivity to the sugar. So that can set off an inflammatory response. That's going to set off hot flashes as well. Filtered water. Now, I don't drink filtered water, but that may be a trigger. And then anything like diet pills. Hopefully none of you guys are taking those. Don't take those. Hot, spicy foods. That's a real hard one for me. Drink your cold water before and after it. You're probably going to get a hot flash.
That's an interesting one. I did not realize that.
Yeah, because think about it. That's going to set off an immediate reaction, right?
Absolutely, yeah.
Yeah. And the other thing you can do at night, besides the fans and the air conditioning and the cold thing, is actually putting a cool pack under your pillow or in your pillowcase. And sometimes even some women have gone so far as to get larger beds if their partner is a little bit different body temperature than them. They can't take it anymore. And someone, of course, this group probably wants to know about exercise, right?
Yeah.
So I would say to you guys, I wouldn't change a thing about what you're doing just for other reasons to maintain your health through and beyond menopause. Because you want muscle mass and you want great aerobic capacity. That is going to protect you against some of the biggest diseases that women face after menopause. It's completely preventable. So don't change a thing about that. However, all that aerobic exercise increases your heart rate, right? Boom, now you got hot flashes. So what you could consider doing, besides some of the cooling techniques with the fans and the layered clothes and all the other things that you've probably heard about, is try some down training of your sympathetic nervous system. That's the one that's going to raise your heart rate. You want to down train your heart rate. So meditation, slowed breathing. If you breathe into the count of 4, hold it to the count of 4, slowly release, breathe in through your nose, out through your mouth. That will, if you do that about 3 or 4 times, that lowers your heart rate. And that might manage a hot flash. yoga, which is great for flexibility. So it might actually be a nice adjunct to jiu-jitsu, right?
It really is. It's absolutely a great adjunct.
So I'm talking about the slow-mo yoga. I'm not talking about vinyasa where you're, high moving and aerobic yoga. I'm talking about traditional, slow, controlled breathing yoga where you're getting the flexibility and the extension and the breathing. That has actually been shown in research to reduce hot flashes. So doing those, if you're doing one, I would do the other. And make sure that you're getting that balance between them in terms of what we're doing. The last thing you can do, besides all the air conditioning, little things. Say you have to go to a meeting, get there early and find the coolest seat. Little tips like that. So you don't have to sweat through the whole thing. And then the big thing is know that every individual, I'm telling you all about these hot flashes and all the things that set them off, but some of us get hot flashes and we can eat the hottest, spiciest Mexican food out there and it doesn't trigger it. But others take one bite of that, the salsa, and they're just sweating like mad. We all have our own triggers. So what really is helpful is to keep track of your triggers. Things like, so you can do this on your phone, you can do this, write it down, whatever, but just know, okay, you're getting a hot flash. Where are you, first of all? Is it a hot environment? Is it a cold environment? Are you in your office? Are you at home? Are you exercising? What are you doing? When you got the hot flash, where were you? What's the time of day? You might notice that you're only getting them at night, at a certain time of night, or are you getting them all day long? Are there certain times a day where you're getting them? And so we want to know when it occurred. Also, how intense were the symptoms? Mark that down. And how long do they last? Some women, it's only a minute. Some women, it can last 5 minutes or more, and then it'll slowly subside. Did you eat or drink anything right before you had a hot flash? And that would be not something you ate 2 hours before. That's not setting off a hot flash. You'll know within minutes. Eat something or another thing that can set it off. I hate to tell you this, ladies, but alcohol. Alcohol can set off hot flashes big time. Yeah. So yeah, I know, bummer, right? So if you are going to drink that glass of wine at night, water before and after it, try to flush it through the system. Okay. That's what we tell people for pelvic floor. I have no idea if it'll stop it. It's going to help your bladder anyway.
Right. Absolutely. There it is. Bladder's good then. Yep.
And so, you kind of want to identify any food or drinking triggers, because you might find some, maybe you can drink a beer, but you can't drink the wine.
There you go. Experiment.
How are you feeling? Were you tired? Were you really tired? Were you fatigued? Were you really stressed about something? Just note your mood. And then the last one is what did you try to do, if anything, to alleviate the symptoms, and did it work? Mm-hmm. So, what did you do about it? Did you just sweat it out? Did you get a cold pack? Did you try deep breathing? And did any of that work? How long did it take? So just keep those notes.
Is it safe to say that this would be a great resource to bring to your healthcare provider? So it would be good information. It's all these notes, because it's so important for them to listen to you and hear your information and what you're experiencing to help guide them.
Absolutely. Your hot flash triggers are really helpful, because any hormone, say you want a treatment, prescription medicine, they actually don't, what we do know from the research, and that's another reason with the bioidenticals maybe not being effective, is we do know that hot flashes aren't directly related to estrogen levels and the serum in our blood. And the reason is because estrogen can change like that. So you can go really high and be down in minutes. So it's just a snapshot in time. That's why hormone replacement therapy is never, or should never, be done on labs. You can take labs to kind of monitor it over time. They're most effective if you do it multiple times a day. But honestly, you'd go by symptoms. So if they know your symptoms, That's really helpful. And you might find that they're clustered too. Maybe they're occurring more around the period and then they kind of ease off for a couple weeks and then they start up again. So that might be, and that's also going to give you good evidence if you do try something. Rather than trying everything all at once, you might try one or two things and track how effective it is for you. And that's really good advice, good help for a physician. The more data you can give people who can help you, the better.
Yeah, and bring it in so you don't forget anything. I tell my patients all the time, bring in your questions. Don't be afraid to pull your list out. It's so important.
Very important, very important. And actually finding physicians that are knowledgeable on menopause are really hard. So the North American Menopause Society does have a provider resource, and they'll tell you people in your area. I'm on that resource. They've sent me pelvic floor, they've sent me patients with menopause type symptoms where I'm not a physician, but I can still provide them with a lot of education. And actually a lot of you are going, if you get this education, you can help a lot of women too, but also you can help them find people who are good in their area, which is hard to find. It's really hard to find.
And I'll have the link on for all of you guys. I'll put the link on in the group so that you have it right away. Perfect.
Yeah. And actually our we do have, a course. Is there any other questions? Anybody else?
Yeah, I haven't had any so far. So I think you have done an amazing job hitting them all. I think you're answering everybody's questions.
Okay.
There's a lot of people watching that you can't see because StreamYard doesn't let you see that part, but we have a lot of people on watching right now.
So this is just the tip of the iceberg. Know that there's over 200 symptoms of perimenopause. I mean, so not everybody feels the same things, and it's not the end of life. It's really not. And honestly, if you get education early, you can prepare yourself and be healthy well beyond. You could still be doing jujitsu at 90.
Yes, that's the goal,
right? But you know what? The problem is finding the education. And so that's what we're doing. We had developed a 2-day webinar, and it goes over not only hot flashes, but a lot of other common symptoms, but also things even that things that we as physical therapists treat, things that counselors treat, things that physicians treat. So if what you're not treating, you at least know where to send them, because sometimes they don't even know where to go for help.
Right.
I mean, they just like with pelvic floor therapy. I'm still getting patients coming in after doing this 10 years saying, I never heard of a pelvic floor therapist.
I know. We can help you so much. That's
I want 2 years.
I know. Come on. I know you want to shake them.
Yeah. So it's kind of, menopause is the last frontier, and people are afraid of it. Because honestly, I've even had other women's health physical therapists say to me, like, I'm not there yet. Like, they're afraid about it, and they don't need to be afraid. They need to be educated. And everyone who gets this education, like everyone in this group today, will not only know some basic facts, but they'll be able to tell their friends basic facts and pass it on.
We can't be afraid of something that 100% of us will go through.
Right. And if you're if you're a physical therapist, whether you're orthopedics or pelvic floor, if you're a nurse, if you're a dietitian, a personal trainer, we welcome you at our course too. A counselor, anybody who treats women in their practice.
And so we'll have that link too. We'll have the link to your. You want to speak about that a little bit, because I think you're running a deal right now. Yeah,
$50 off our Independence. It takes Independence Day. It takes a village sale. We want to get this information out there, and so anyone who signs up gets a whole summary of the hot flash fast facts, and that's they get a PDF of that just signing up on the mailing list. And that's a lot of the stuff we just talked about. You guys are my inspiration for that.
Thank you.
There's a code. It starts today, and it goes through July 4th for $50 off. And the code is July Sale 2020, all in caps.
Okay.
So you can, I haven't even advertised that yet. You're the first that just went on. July Sale 2020. That's the coupon code. Yep.
All right. So I'll make sure I have that link.
And if it doesn't work, you just send me an email.
If it's a fairly quick answer for you, would you be able to speak on the brain fog at all?
Yeah, we do talk about that too in our course.
Okay.
It's a real thing.
It is a real thing.
So yeah, so what that is again, that's due to those hormonal fluctuations. So as every month, like clockwork, from the time we're about 13, 14 years old till we hit about 52, we are going through the same cycle of hormones. And I'm not going to get into that here too much. No. Just know you're releasing those same hormones. Well, then think about that Ferris wheel getting a little bit off kilter. So now they're not releasing as regularly. Well, that has a profound effect on all these, a cascading effect on all these other hormones that are released throughout our body. And some of those hormones actually affect the brain. So that brain fog, women actually, it's scary. Because it's really scary if you're going through it, because you think you're getting early Alzheimer's. I mean, honestly, I thought I was getting early Alzheimer's. I'm here to tell you that it is totally normal. Diet and exercise do help with that, and in terms of just not watching TV all day and stimulating your brain, and then just using the tips to remember things. It does get better. It's only a temporary situation, and it tends to settle out. Mm-hmm. So, staying active and doing the things that you normally do, and just know that, okay, maybe for this period of time, I need to remember where my car keys are and start putting them in the exact same spot every time. I totally feel for you, ladies. I went through that myself, and sometimes now I still get it, but it's more related to too many things in my brain, and there's just not enough.
I don't doubt it. You have a lot of information in there.
Well, it's like I have a million different things going at different ones, but I'm kind of ADHD, so it works for me. Right. But just know that brain fog's totally normal. It's just a normal change. It does settle down. It's not forever, and you don't have Alzheimer's.
Right. All right. Well, you know what, Karen, I have to say, with as much bad news as your specialty delivers, you deliver it in a positive, hopeful way. I think you have given such valuable information. You guys have, I hope you understand what a wealth of information this has been. And my prayer is that everybody is able to grab onto this information and just go into their healthcare providers, go into their friend groups, and just give this message of hope and information empowerment. And I am so thankful for you for coming in to join us today.
I am so thankful for the opportunity. And one last thing for brain fog, I almost forgot. Yeah. Add more omega-3s to your, we're supposed to have a balance between omega-6s and omega-3s. Mm-hmm. And we have like 6 times more omega-6s than omega-3s in our diet. And that's things like fish, and things like that. If you have to get supplements, then do supplements, but food is better. And actually find out what foods. You can even get some foods that have supplements of omega-3s, and that does help with brain health.
Great. That's a great tip. Thank you. So many good tips. So, okay, I'm going to provide the Menopause Society link, the link to your course, and also how do they obtain this little handout that you
so if you go to the website, snowdenlitos.com, you will see on the front page, sign up for our mailing list. Just sign up, and it'll be an automatic email to you. If you want to learn more about the course, there's a link to the course. It's really pretty user friendly. If you want to send me a message, then just send me a message. Use the contact me button.
Great. Thank you so much.
Oh, Michelle, it's been a pleasure. It's nice to meet you all.
I told you, as soon as I get to meet you in person, I owe you a big hug.
Girl hugs.
Thank you so much, Karen. All right, we're going to let you go. We appreciate your time so much.
Okay, bye-bye.
Bye. Thank you.